Hi, I'm Connie.
Hey, I'm Tyler.
And I'm Cody. Today I would like to talk about post-traumatic stress disorder, or PTSD for short. PTSD is more than just in your head. The symptoms of PTSD can actually manifest into physical ailments. PTSD is classified as a psychiatric condition that can be developed in people who have witnessed or experienced either a single traumatic event or a series of traumatic events. These events are usually physically or emotionally harmful to the individual, such as war, abuse of any kind, illness, death, or even natural disasters. PTSD has a wide range of symptoms, and symptoms are common among all trauma survivors in the days and weeks after, but to be diagnosed with PTSD, symptoms must persist for at least 1 month. This comes from psychiatry.org. The physical manifestations of PTSD. Some people experience depression, but this is also accompanied by memory loss, substance abuse, just to name a few. PTSD can happen to anybody at any age. There is no limit. There are 4 categories of symptoms for PTSD to be diagnosed. Intrusion, which includes flashbacks of the event, nightmares, anything unwanted that your mind brings to the surface. Avoidance, so you'll avoid triggers, you'll avoid places or people. You could avoid people that would bring back those memories from that traumatic event and cause the anxiety attacks. Cognition and mood changes. A lot of people have trouble with memory after suffering a traumatic event. Arousal and reactivity changes. This includes like your day-to-day activities. You don't want to go out in public anymore. You don't want to do things you used to enjoy. Though these are the 4 categories that you are diagnosed with PTSD with, most people who suffer from PTSD also suffer from disassociation, and which includes derealization and depersonalization. Derealization is where you don't know, like you're here but you're not here. Like life, you feel like you're in a movie. You don't feel like yourself. This comes from the Mayo Clinic. Prevalence of PTSD in the U.S. According to GoodRx, in the U.S., about 4% of adults and 8% of adolescents, and adolescents is kids aged 13 to 18, suffer from PTSD. And the lifetime prevalence of PTSD in the United States is 6%. That's a lot of people. There are risk factors that can lead to PTSD. A history of trauma. So if you have experienced any trauma prior to another big event in your life, you're more likely, or you could be more likely, to develop PTSD. Childhood adversity, being of the female gender, or marginalized identities. So being that you are not a part of a more broad group, I guess could give people PTSD too. There are treatments for PTSD. There is cognitive processing therapy, trauma-focused behavioral therapy, group therapy, and more. Medications can also be used to treat PTSD, and these would include antidepressants and anti-anxiety medications, says the Veterans Affairs. And in conclusion, PTSD is a serious disorder, and if left untreated, it can ultimately lead to the unimaginable. But the good thing is PTSD can be treated. Bringing awareness to PTSD could save a life. Providing support for those suffering with PTSD can also save a life.